Okay, so my wife was just practicing her suturing. She just started a new job, and I figured I would take this time to teach you guys how I close skin usually in surgery. So the first thing you want to do, and granted this is not the suture that we use, but it's dark, so I figured I would use this one. The first thing you want to do is go from deep, come to superficial, and come out somewhere close to the skin, but not above the skin, okay? And this is sort of like our anchoring knot. What we're going to do is we're going to tie it in the corner there. Tie that, and tie that. About 4 knots is typically good. Then we take our scissors, cut it right at the knot, and then what you do is you take your needle here. You can grab it with an adson or however you want to grab it. I'm pretty comfortable with needles, so I usually just grab it with my hands. Then what you want to do is you want to come out from going from deep to superficial right at the edge of the skin, wherever the incision starts. This is pretty much going to let you start so that you can close the whole incision. All right, and then what you do is you take bites going from one side, coming out to the other, just like that. These tools are not the greatest, but I just want to demonstrate. So I'm just going to show you a few throws, and then I'm going to sort of show you the end product here. So this is kind of how you want to take the bite. You want to come from the incision where it starts, come out, and then sort of work your way down. So I'm going to show you like 2 more bites, and then I will do the rest so you don't have to sit through this torture. Let me show you 1 more bite here. So now you can already see if I pull it, you'll see the skin is coming together nicely. And I'm pretty much going to run it down all the way, so we'll stop the recording here. Okay, so I've sort of worked my way down the incision enough that I have a few bites left to take. So now I'm going to show you how to take those last few bites and then tie this all through. And it's going to look beautiful. And the beautiful thing about this is how you close the skin, and the patients don't have to worry about coming back in the clinic to get the sutures out, because you use typically like either monocryl or some sort of a monofilament absorbable suture. Oh yeah, I was thinking of what the other name is because it was escaping me, but it's called a biosin. It's either monocryl or biosin, depending on which brand the hospital uses. And then you take your last bite here, sort of come out right where the skin is supposed to come together. Of course, actual skin feels a lot different than this material here. And then I'll show you a cool knot. So you have kind of your suture running out, you have this loop, and you have the suture. You take the suture through and you just run it down just like that, and you can tighten it. And then you take the loop again, you run the knot down, take the loop again, take your suture, run it down. It's called an Aberdeen knot. And then you just pull that through, and then you'll see there's a knot sticking out. So what you do is you load up your needle 1 more time, you take the knot, you pull it up, and you go right under the knot, and you can come out anywhere on the skin. Just be mindful of like the structures that might be underneath, because you don't want to poke them. So go as deep as you're comfortable, and once you pull it through, the knot disappears, and voila, the incision is closed. That's how you do it, and then you can just cut it off, and it's all good.